Hi everyone, this is Andrew Guyman. I'm a fourth year medical student at the University of South Dakota. We're continuing our Anesthesiology 101 lecture series today on day 5, discussing the Anesthesiology Basics. So this lecture is going to cover the different types of anesthesia, the different phases of anesthesia, and the different stages of anesthesia. It's really easy to get these three different things confused because they all sound pretty similar, but we'll delineate these clearly. And then the last thing that we'll touch on are discussing the 7 different pillars of anesthesia, which all happen to start with the letter A, just like Andy. So there's 3 different types of anesthesia: regional anesthesia, sedation / monitored anesthesia care, which you'll commonly hear referred to as MAC, and then general anesthesia. To me, sedation / monitored anesthesia care, these two are kind of a continuum, so we'll discuss those together. But before that, we'll discuss regional anesthesia. So regional anesthesia is a technique that places local anesthesia next to nerves to just numb the nerves. Broadly, it could be divided into 2 different categories. So one would be providing peripheral nerve blocks. So this would include like an interscalene or femoral nerve block. And then 2, neuraxial anesthesia. So most commonly would be like an epidural for labor or a spinal for a C-section. Sedation / monitored anesthesia care, or MAC, is a very broad category. So the ASA defines monitored anesthesia care extremely vaguely. Their definition is a specific anesthesia service provided by an anesthesia provider for a diagnostic or therapeutic procedure. So that could literally be anything. Dr. Jeff Steiner, he wrote Anesthesia Made Easy. I would highly recommend that textbook. He refers to a MAC as an experience of increased hypnosis and decreased pain and anxiety. So again, a super broad definition. Part of the reason that it is such a broad definition is there's multiple different levels of sedation. And this kind of gets into the continuum because as you increase sedation, you move into general anesthesia. But I think this would be an appropriate place to discuss the different levels of sedation. So the first being minimal sedation. This is also known as anxiolysis. So an example of this would be providing Versed to a patient prior to maybe like a root canal or something along those lines. And it's defined by a patient having normal response to verbal stimuli. The next level of sedation is called moderate sedation. This is also known as conscious sedation. And then it's defined by a purposeful response to either verbal or tactile stimuli. So kind of the difference between minimal and moderate is a normal response. They're able to have a conversation with you versus purposeful response. Maybe they're not as in tune with everything that's going on around them, but if you move their shoulder or if you say their name, they might open their eyes or look at you. And then the last level of sedation before reaching general anesthesia is known as deep sedation. An example of this might be a patient who's receiving a colonoscopy with propofol. And this is going to be defined by purposeful response to painful stimuli. General anesthesia is the process of making a patient unarousable even with painful stimulus. This is the 4th stage of the different sedation levels. So the first 3 are minimal sedation, moderate sedation, and deep sedation. And then the 4th stage of sedation is general anesthesia. General anesthesia is generally required for a few different reasons. So the first being too much pain to be managed with just regional anesthesia or under monitored anesthesia care. The other would be if you're having difficulty managing the airway with monitored anesthesia. And then if you had contraindications to using monitored anesthesia care or regional anesthesia, or if the surgical procedure was occurring in a place that just didn't allow for regional anesthesia, then you might have to use general anesthesia as well. The last idea that I wanted to touch on is these different types of anesthesia are kind of fluid, so you can move between them or you can use them in conjunction. So generally, if you're going to be using them in conjunction, it would be using regional anesthesia plus monitored anesthesia care or general anesthesia to provide pain relief during the operation and then also following the operation. And then if you're switching between them, normally what you would see is like a classic situation would be starting off with monitored anesthesia care and then moving into general anesthesia. So there's a couple different reasons that could happen. Like a common example would just be if the surgical procedure switched. So maybe they were doing a procedure to diagnose brain aneurysm, and then they found it and they needed to like treat or coil the brain aneurysm, and they wanted the patient to then be paralyzed to be still because they're working on it now. So they then might switch from monitored anesthesia care to general anesthesia. Other common reasons would be if the patient is moving too much during the procedure, if they have hemodynamic instability, if they vomited, if they're coughing or have hypoxemia. Those would all be the most common indications, according to the Baby Miller textbook, of switching from monitored anesthesia care to general anesthesia. So there's three different phases of general anesthesia, and the process of providing general anesthesia is often compared to flying a plane. So both general anesthesia and flying a plane are generally safe, but they can have moments of true danger. They both require specialized training, and the most dangerous parts of general anesthesia and of flying a plane occur during takeoff and landing, during flight, or during induction of anesthesia and emergence of anesthesia when you're providing anesthesia. So traditionally, the three phases of anesthesia are induction, maintenance, and emergence. Before we get into those, I wanted to talk about one phase that kind of comes a little bit before that. So that would be the preoperative period. There's definitely a push within the field of anesthesiology to view the anesthesiologist's duties as perioperative medicine as a whole. So that would include the preoperative period and the postoperative period. But during the preoperative period, a few tasks or things that would occur during this time would be taking a history and physical, optimizing the patient for their surgery, or determining if it was safe enough, if they were optimized in a way that they could complete their surgery. Obtaining IV access, and then providing any anxiolytic agents that would be needed. Induction into anesthesia includes the pharmacologic inducing of anesthesia, so that's commonly seen with propofol, ketamine, etomidate. Includes securing the airway, positioning the patient, and then obtaining any additional monitors to provide safe anesthesia care. So in Rapid City, most of the time, we would see arterial lines placed in pre-op. There's some places, one of my attendings went to residency at the University of Alabama, Birmingham, and he said they would always place arterial lines in the patient in the operating room during or after induction. Maintenance of anesthesia includes providing hypnosis. So this is making the patient fall asleep or making them stay asleep, providing analgesia, keeping the patient paralyzed during the procedure, and then remaining vigilant throughout the operation, watching for any concerning signs. Emergence from anesthesia includes stopping or titrating medications, removing the airway device, reversing paralytics, and transitioning the patient to PACU care. So there's 4 different stages of general anesthesia. When you induce a patient into anesthesia, you'll see them progress from stage 1 into stage 3. Stage 4 is dangerous, so we try to avoid that. And then as a patient emerges out of anesthesia, you'll see them move from stage 3 back into stage 1. So stage 1 of anesthesia is known as analgesia. So this is where a patient begins to become sedated. Stage 2 is known as excitation. This is a super important stage because it can be dangerous. So during excitation, you'll see an increase in heart rate, an increase in blood pressure. The patient can become combative and move like they're awake, but they're actually deep asleep. So that's the dangerous part of it. They're also at increased risk for aspiration and laryngospasm. So because of this, I guess two different points I'd like to make. You don't want to extubate a patient during stage 2 because they're at increased risk for aspiration. You can also trigger laryngospasm. Additionally, especially with kids who might be more sensitive to laryngospasm, you want to be very careful when they're in stage 2 to not cause any sort of noxious stimuli. So even placing a tourniquet around a kid's arm while they're in stage 2 could trigger a laryngospasm. So just being really careful to let the patient go through stage 2 calmly without any sort of stimuli would be best and safest practice. And then stage 3 is known as surgical anesthesia. So this is where a patient is, like, in quotes, deep enough for surgery. Stage 4, and during stage 3, you have your heart rate and blood pressure return back to baseline. And then stage 4 is known as coma, and your vital signs collapse. So you'd certainly want to avoid that. The last topic that we'll touch on are the 7 A's, or the 7 pillars of anesthesia. So the first one is anxiolysis, which is just relieving anxiety. This is commonly done in pre-op with Versed or benzodiazepines. Next one is amnesia, so that's the inability to remember. Anesthesia, I also include it for this purpose as hypnosis. So providing an unconscious or sleeping state. Analgesia is providing pain relief. Akinesia is paralysis. Areflexia is making muscles not respond to stimuli. And then autonomic control is maintaining desired vital signs primarily, is the way I think of it. I hope that this lecture helps cover some of the pillars of anesthesia, the stages, phases, and types of anesthesia. Let me know if you have any questions.